Coming to the pathophysiology, at the cellular level, you might have cytokine release, myocardial depressant substance release, prostanoids, endothelial upregulation and activation of coagulation system. In coronary artery disease, there might be regional ischemia and sepsis. All affects the myocardium in sepsis. Apart from that, this cellular reaction further can cause an addition and infiltration of monocytes, impaired oxygen utilization, endothelial activation, impaired coronary microcirculation, monocyte activation and nitric oxide concentration increase. All this lead to myocardial dysfunction at the cellular level. To summarize, the sepsis leads to inflammatory mediator release, here nitric oxide increase release and reactive oxygen species, and this causes mitochondrial dysfunction, downregulation of beta adrenergic receptors and disturbed calcium trafficking, which is going to cause your myocardial dysfunction. This downregulation of beta receptor and depression of post receptor signaling is caused by cytokine and nitric oxide. Other factors which affects the myocardium includes your toxin, complement products, damage associated molecular pattern, which is DAMP, neutrophil extracellular traps, that is NET, and myocardial depressant substance. Another important concept in the pathophysiology is cold shock and warm shock. What is warm shock? You have an infection, microbes come in, you have immune cells, cytokines and nitric oxide which is released, which leads to vasodilatation. Whenever there is vasodilatation, it is going to be warm and this is called the warm shock. And if this shock persists, there is going to be cardiomyocyte hyporesponsiveness, there is going to be cardiomyocyte injury and the release of neutrophil extracellular trap, myocardial depressant factors and various factors which can be released which causes cold shock. So from warm shock you move to cold shock and this cold shock can produce multi-organ failure. Coming to the various phases of myocardial dysfunction in sepsis, you have various stages. This is the normal one. As sepsis sets in, early phase is there and with your fluid loading it might move into the resolution phase or sometime it goes into the late phase. Normally an heart pumps and it supplies the blood to the peripheral circulation and it meets the oxygen demand in the peripheral tissues. This is our normal circulation happen. But in sepsis, what is going to happen? There is peripheral vasodilatation and capillary permeability is increased. This decreases your preload to the heart. Your ejection fraction may be maintained because your preload is low, your stroke volume comes down and there is an increased heart rate. So at the early phase of sepsis, your left ventricular ejection fraction is not compromised. It will be more than 55%. But your stroke volume is low because of insufficient cardiac preload due to high permeability and severe vasodilatation. The compensatory increase in heart rate which is required to increase the cardiac output may be insufficient. This is early phase of sepsis.